prostate cancers. So maybe the doctors needed to take tissues from the body because we want to make sure this kind of regions actually is cancer. So the next step is to take tissues from the body, for instance, for its prostate. So actually this is a surgery part. So take the entire round of the prostate and get the slice from the tissue sample. So for this side, the image size actually is about the micrometers. So in this size, the human eye cannot see it. So we did use the microscope to see the disease. Actually, to analyze the disease in the cell size and the tissue size. And also we can analyze for each individual cells. We can identify them, use the machine learning, as Professor Mansell said, use the machine learning-based model to identify the cells and analyze the shape of the different cells. And also we can get statistical information for entire cells within the vision areas. We get the disease based on the machine learning-based model to get the disease information, more detailed information. And also analyze the specific individual cells. And also we can analyze the molecular information from each individual cells and the genetic information here. So I think this size is the nanometer size. And also we can get some information taken by the warning signal, as Professor Monsif has really good in this field. We can analyze the biosignals from our body. We can get warning signal information, analyze. We can get information to analyze disease. So for these different scales, different modalities, you can see the information has been scaled in different sizes and different modalities. So actually, I think in the hospital, I think each department has work individually. For instance, radiology, pathology, and laboratory work individually. So actually, we can see for the same patients, the information has reflect from different scales, different modalities. Actually, represent the information in different angles to see the disease. So if we use the machine learning-based model, we can, knowledge alignments, and also knowledge extractions and knowledge representations to integration for these different modalities. That is very important for this part. For currently, the diagnosis as this very famous problem, stories, the brain and elephant, right? So each part has working. I can see the disease, just the individual part. So not the whole elephant. They only figure out the elephant is a small part of the image. So this is why the result of overdiagnosis and overtreatment for in the hospital. So you can see for maybe information we can take from images, meteorology images, pathology images, and metabolics information, and protein information, and transportation, protein information, and genetic information from different scales. And also we can also work on maybe currently a lot of work working on single modalities for the tax information that's being worked on, and medical records, and also the images. So maybe we can use the models to integrate them together. I think the large language model or foundation model can better do that. What do we focus on? The two, the modality of images, radiology and pathology, is important because they cover 90% of all the healthcare data. is a very common data set, data modalities in the healthcare. And in our group, we're working on the, just mentioned, the disease in different parts. For instance, in the early stage of disease prevention, we have a lot of some of the people working in this field, and also in the stage of disease diagnosis and classification. Some of them working on that. Dr. working here is I think medical records, and also the multi-modalities fusion and the risk prediction assessment for the disease, and also prediction response of treatment for the disease and also recurrency and the progression of the disease, and also survival. So we can use the data to predict the future of the disease, or the progression of the disease is what we do. So our scientific premise is tumor morphology can contain some very critical diagnostic information in images. So for instance, the tumor morphology reflects the sum of genetic, protein and metabolic changes and alteration of tumor cells. What we want to do is we want to take information from these images to get predictions of some genetic changes. This is why what we do is the images to do this kind of very interesting work. So actually this image is very hard to do that, because we can see the image is very complex, a lot of tissues, a lot of cells, and very complicated images. So based on the foundational model, we can very fastly segment different cells in tissue together. So for instance, we can use, as the Professor Manson said, we can use zero-shot model, segment anything. We can automatically segment different parts from these tissue sample. For instance, the cells and the tissues and the lumen, different parts. Why is it important? Because all these cells and tissues and lumen are very important to make decisions for the diagnosis and prognosis for the disease. And also for instance, for maybe the basic reading system. So usually in the hospital, the doctors to get the grading, basic reading based on this kind of shape. Actually, for some of the basic reading is very hard, even for 10 years to 20 years, pathologists, to very hard discriminate between basic reading 3 and basic reading 4. So, however, we can train the model to identify the malignancy of different parts. For instance, this is left side is the regions we identify based on machine learning. We train the model to identify the different tissues. Then we can compute the percentage of different parts. Then get the computerized basic reading system. So it's very accurate and very fast for the diagnosis for prostate cancer. And this is biopsy. We can identify them. And also, as I just mentioned, maybe the machine is very good for fusion different image modalities. For instance, we can registration between the pathology and radiology. We can use this and pathology as an example. We can registration from the MR images into the pathology images. So registration, after registration, we can analyze the different modality, because this modality reflects the neurometry size of disease. This reflects the mechanism size of the disease. So currently, as I mentioned, the radiology working visually, pathology working visually. Actually, it's reflect the disease in different angle. Yeah, for instance, this example, this is histology, and this is radiology. This is diffusion. You can see this is the pathology in the malignancy part. And also we can see the malignancy part from the radiology as well. So we can integrate together because this is very powerful. We can get information from two different skills. Information. And also, I think the machine learning and very powerful to analyze the thousands of cells. For instance, maybe it's very hard for us to count maybe tens and thousands of cells. However, we can train the model to analyze the tens and thousands of cells. Why is tens and thousands of cells is very important because the statistical information can reflect the prognosis of the breast cancer. This is an example. What we working together with the Fudan Cancer Hospital, the Department of Breast Cancer, and we take the tissues from 637 patients. So they will digitize this, the regular glass size and the digitalization. Then we give a model to analyze the cells. We identify 4 different kinds of cells from 637 patients. We analyze the 410 million cells. Actually, it is impossible for human being to count them. So we analyze also, we can analyze the single cell clusters, and also we analyze the ecotype of the cancer from patients. And then we analyze this to predict the clinical relevance of clinical information, clinical problems. For instance, AIC score maybe indicates immunotherapy response. Why is it important? Because before this therapy, the human is very hard to predict the responsible of the patients. So a lot of times after the therapy, we can find the patient actually not response to this kind of therapies. Maybe it's a really late stage. However, we can use the machine learning based model to predict the response of the patient for this specific therapies. This is what we want to do in this field. And this I will get one more clear. So we can also use the machine learning to analyze the medical cell type. Actually, this is needed to use medical information to get the medical cell type. However, we can use this glass slides, this regular glass slides in the hospital. We can predict this medical cell type of patients. Why this is important? Because medical cell type represent different kinds of therapies for the patients. And a lot of imaging analyze problems of histology images. I'm going to not give more details. This is also the integration of images with text information, medical records, integration of predict the survival of the patients. And this is integration between the histology and medical and genetic information. We supervise the model, with other modality. For instance, we use this channel of histology images to supervise the feature learning of genetic channel. And then genetic channel also supervise to change, to select the better features of image channels. This is the multi-modal problems. And as Professor mentioned, so we need to model usability. We want to use some very famous model to identify why the model made some of the decisions, which part is more specific these images. This attention visualization or interoperability of the machine learning model. This is for, I think, for city images. We use the pre-operate city images to predict the, I think, macro vessel relation for the city, for liver cancer disease. And also, I think they use the biosignals to predict the low blood pressure for the patients in the emergency room. This is very interesting problems for the doctors in the emergency room. And then we also have, I think, institute sampling